Hello, everyone. My name is Kathryn Harris, and I'm the marketing consultant for Leaf Mental Health. Leaf connects patients with therapists throughout the country, providing services remotely. Today, we have the privilege of speaking with Dr. Jessica Greenberg, who is a clinical psychologist based in Maryland. Hi, Dr. Greenberg. How are you?
Nice to meet you, Katie. I'm well. Thanks for having me.
Of course, of course. So today our topic is going to be when is the right time to find therapy for your child? We're in a time where COVID runs rampant. There's a lot of anxiety, and it's, I think, a perfect time to just kind of touch base with a professional in this area. So I think we're going to be asking you some pivotal questions regarding this topic, and we're hoping that it will be helpful for parents as they're seeking to provide relief for their kids. So let's get started.
Sure.
Okay, great. Okay, so the first question I think that we wanted to give for our audience would be, how do I know when to start looking for a mental health professional to help my child?
Sure. I mean, I think it's one of the most common questions. And, I think there's a number of different factors that I think are at play when this is something that parents might start to wonder about. And I think, first and foremost, anxiety and depression was really on the rise in a lot of children and teens in particular, even before the pandemic. And so we were really seeing a peak, and that anxiety is probably the number one reason why any parent is going to be bringing their child to treatment. And then, of course, we have the pandemic. So that really exacerbated everything, and particularly in light of the last few years, which really is just heightened, but and really raising issues that have been longstanding with racial injustice and climate issues and natural disasters and all these things in our world that really can create a lot of fear, and also just a tremendous amount of loss. Really has created a lot of fear and concerns about the safety of kids and their families and their loved ones. So ultimately, one thing that I will say to families when the question comes up is that, first of all, I always try to remind families that anxiety is in everyone. It's typical. We all experience anxiety. The main thing that we want to keep in mind is that I always say intensity, frequency, and duration. So how intense is the anxiety? How often is it happening? And how long is it persisting? Because that will usually guide whether it's time to start seeking professional support. Now, a lot of times I also let parents know that even if your child, presents for, let's say an initial assessment, and there really isn't any diagnosis that the child is, qualifying for, that doesn't necessarily mean that treatment isn't indicated, because you don't have to have a diagnosis to get help. Because really what we're trying to do is help families understand that we all have big feelings. Sometimes, it's good to have anxiety because it's our alarm system. It lets us know when we're in danger, when we're in trouble, and we have to pay attention to that. But if, and kids feel worries and fears, all the time, because that's part of growing up. Right. However, when it gets to be excessive, then it can really interfere with learning. It can interfere with social relationships, and of course, disrupt family life. And so at that point, that's usually when I would say, that's a good time to at least consult either with your school counselor or your pediatrician and let them know, maybe there's been some repetition, maybe there's been some avoidance of some kind. Again, particularly in the pandemic, we've seen a lot of our kiddos who are sort of hesitant to leave the house, or they've been so used to being at home in their safe, secure homes, particularly kids who already were struggling with anxiety. And then we've got kids also struggling with loss. So, this is where also with teens, it can become a little bit more complicated because, I have parents say, well, it's a little vague and confusing because my teenager is kind of mopey and in their room a lot and, kind of isolating. Well, is that a phase or is that depression? And so, similarly, what I will say is, well, try to be curious with your kids. And I know maybe we'll be talking at some point about what to do, but ultimately, monitoring it. And then when you're really not sure, always err on the side of caution and consult. So again, whether that's with your school counselor, Sometimes there might be overt issues in school, but if there's not, that's a professional who's in the system already, or your pediatrician, and they can always make referrals. Obviously, also there's some pretty amazing resources that can be offered by schools and medical systems as well. So that's generally what I would say. Sometimes it's going to be more overt than others, but always err on the side of caution.
That's great and so succinct too. I think the biggest takeaway I just took from that would be maybe look for when maybe normal activities, like they're not maybe responding like they typically would, like that seems to be that first red flag, possibly. And I'm sure many other red flags too, but
yeah,
to stand out when you were talking, kind of looking for those isolation keys, and going from there. So no, thank you so much. That was really helpful. And I would say the next one I would really just directly go to would be, how can we support our children when they seem anxious? So maybe if they haven't gotten to that point yet, but in the meantime, when we're just dealing with our normal anxieties, how could we possibly help our children with that?
Absolutely. And it's everywhere, right? And so I'm just talking about how typical it is. And yet, of course, sometimes it's really intense. And again, being in the pandemic, that certainly has heightened, I think, everyone's anxieties, because really sort of the epicenter of anxiety is sort of what we don't know. And uncertainty has really predominated our worlds really for the last, hard to believe, almost 3 years. And so anxiety and fear are common responses to that. So what I say to parents is, number one, again, just recognizing and feeling validated that we all feel nervous right now. That is a common and appropriate response. The other thing is that I really try to work with parents on emphasizing how instrumental they can be. And so, the first step is really, being able to accept and validate, right? You want to listen to your child. So, even if it is so big and it's really overwhelming, that you can just listen and accept and validate what they're saying to you can make a huge difference, even in itself, of just sort of bringing those emotions down a little bit. Now the aim is never to reduce anxiety. I'm sorry, to get rid of anxiety, because that's not possible, right? And that's never our aim as mental health professionals. In fact, what we want to empower parents, and we want to empower kids to be able to know that the anxiety is okay. It's just how you independently manage it that really works for you and your life. So, that's part of the equation, is being able to listen and empathize. The second part is really not taking that on. And that is where I think it can be really tough, because anxiety is, for all intents and purposes, it's contagious. So if you see someone anxious, it just sort of floats through air, right? And it becomes really hard not to just sort of take that on. So it's really important for parents to be able to remember that they are separate people. And so the power and the importance of that is that, in addition to, empathizing and supporting, you're also going to be sort of projecting confidence and kind of being the holder and supporter of that anxious and big feeling, where you're saying, I can see that this is really hard for you, and I can see how upset and nervous you are. And I know you can handle this. You got this. And even if that is far from the truth that this child is feeling. And so those two pieces, sort of being able to accept and validate, but also be able to really instill confidence in children, really helps them to build not only that confidence, but also the confidence in themselves, that when they are experiencing that anxious feeling, number one, it's not going to last forever. Even though we don't always know that. That's a marker for anxious feelings, but that really, it's kind of like, I see my kid, he's fallen in a hole, right? And they're stuck. And that's sort of when the fear and the anxious feeling takes over. And parents are essentially saying, I see you're in the hole, and I'm not in the hole with you, right? I'm over here, and I'm going to help you with this. And that separateness, but also that ability to sort of make that separation, I think is very, very important. Now, some parents may be worried, they might think, well, if I if I validate, or if I like sort of listen, that means that it's just going to get worse. Like their feelings are going to get bigger.
Yeah.
Yeah, exactly. And that's a myth, right? That's not something that actually does happen. Or they're worried that, well, can anxiety hurt my kids? So if I just leave them with that, and I don't take something away that's making them anxious, isn't that going to make it a lot worse? And in fact, that's also a myth, we know, because the more confident that they feel and the more competent they feel with that feeling, the two sort of together work hand in hand. And so I think that those are things that ultimately, are important to point out, because they're common feelings that parents might feel. And on that note, for anyone, any parent that may also have their own struggles with anxiety, I usually recommend maybe some period of their own individual treatment that allows them to be supported with their own feelings, so that they can be available to kind of deal with whatever big feelings are coming at them from their kids. And I think that has been a lot of parents I work with have said that is very helpful, because otherwise having two very anxious people sort of collides, and it makes it feel like a much bigger catastrophe.
I'm sure that I'm really, for myself, taking away, it's a really good reminder for us adults to practice those things. I think we just mesh right away. You see anxiety and you just, I don't know, you want to fix it, so you quickly try to, but that's really important. I think that takeaway of just you can remove yourself slightly to be able to be that person to not be the rescuer in that case, but just to be able to have your own confidence, and to, like you said, to instill that in the child. That is so helpful for me as an adult too, just to share that with other adults. So thank you. That was really pivotal. Thank you.
Yeah, and I think, Kate, that is sort of a critical sort of baseline, because I think that, again, you're right. Seeing any child in distress, no parent wants their child to suffer. And I think the point is that being there with them is not what we're saying that you can't do. What we're saying is that ultimately, the more competence that they have in being able to handle it, which means kind of having to kind of sit with it, the more confident they feel. And then it's kind of becomes something that they've mastered. So then the next time that big feeling comes along, it's going to come along, but it doesn't feel as intense, because they know, oh, well, I dealt with that last time and I survived. Whereas avoiding or having, that tendency to want to sort of swoop in and take it away sort of then takes away the opportunity. And so I think that having that awareness can be very empowering on both sides.
Mm-hmm. That's great. Thank you. And I would say, just moving on, our last question here, it's kind of a wrap up of the first two, but what would you say treatment looks like for children? And just like how often to meet? Is this in person versus virtual? Do you kind of just feel that out based per children or family?
Yeah, exactly. And certainly now, it looks a little different than I think it had, prior to the pandemic. Certainly some people were doing virtual work, but particularly for kids, I would say that it's really going to depend on the provider, of course, and sort of who has availability and comfort, in terms of each practitioner sort of left to their own devices about what they feel most comfortable with.
Right.
Ultimately, what I would say is that it really also kind of depends on the specific needs of the child. There are some kids for whom virtual work really works, and that they can engage and that it doesn't inhibit the work. Now, for kiddos who are a little more depressed, reserved, isolated, maybe socially anxious, then, and also for much younger kids, it is more challenging, of course, to navigate, even though they are more proficient technologically speaking, it can be a little bit more difficult. So I think that is something that sort of needs to be discussed with the practitioner upon sort of getting things started. But in terms of the structure of treatment, at least for me, I have a model where I always meet with parents first. Now, for someone who's a teenager, which I'll talk about in a second, that might look a little bit different, because at that age, as we know, teenagers are really prioritizing independence. And so there are different ways to go about that. But for anyone who's really under 12, I always meet with parents. And in that, sometimes it may turn out that after hearing about what the concerns are and getting a really thorough developmental history, that allows me to get a really clear conceptualization of what I think maybe the issues are, and make really informed recommendations for treatment. Sometimes that might mean just sort of having some sessions with the parents and giving them some tools and education about anxiety, or about whatever the issues are, and then they sort of understand how to respond to the child in a way that kind of diffuses whatever the power struggles or the outbursts or the problems were. Sometimes though, if the behaviors are severe enough or the issues are severe enough, then it might be a conjoint, meeting with the child or adolescent, and then also meeting with the parents. But frankly, I know there's a lot of variability in how providers work, but in my practice, I find that it is integral to a child's improvement that parents are involved, because ultimately these parents are getting burned out day by day. And obviously there's a lot of questions because each child is so different. So I always meet with parents with some kind of, regularity. And really for adolescents, I will sometimes meet with the adolescents first, but always meeting with parents, to some degree, so that again, they feel supported and really being able to know and understand what's going on. Because the more, again, even just for the earlier question, when we understand what we're anxious about, it feels like something we can actually think about and problem solve. And that's ultimately what we're trying to promote. When you're so anxious, you can't even think, then it's hard to understand. And then it feels even bigger. So trying to help, treatment that is tailored towards trying to understand where is this anxiety coming from, and then what can I do about it? That is sort of a big aim. And there are so many different modalities that really look and address anxiety, whether that's cognitive behavioral therapy, play therapy, dialectical behavior therapy, family therapy for more specific issues related to trauma. There's TFCBT, all sorts of treatments out there that there are a number of providers, even just, of course, in the state of Maryland, that will be tailored to the specific issues, of course, that are coming up.
Oh, thank you. Yeah, that's wonderful. And I wanted to touch on too, if you wanted to explain even more about what you do specifically day to day. I know you also work in schools as well. Did you want to touch on anything that you provide, before we wrap up as well?
Sure. So I have had a long history of working in schools, also therapeutic schools. So I've worked with kids who really do have very severe, psychopathology and real significant issues with managing and regulating their feelings. And so for some kids, higher levels of care might be indicated. In my practice, I'm seeing kids, where it's more at an outpatient level, but that families contact me and I collaborate a lot with schools in coordinating care and just being able to ensure sort of what does this child need, and also how can we understand what is bothering them, so that we can adequately support. So I'm very much a team player and coordinating with different disciplines. In terms of my practice, I do, I consider myself integrative. I do play therapy, I also do CBT, but really my main focus and what I say to parents who call me is we want to try to help your child understand what they're feeling and why they're feeling that way. And by promoting that degree of awareness, then it helps people to feel more empowered and able to sort of make decisions and effectively manage what it is they're feeling without necessarily believing that it's going to be gone, but it's about, I can effectively handle this on my own, whether you're 5 or whether you're 18. And so those are things that, again, I work individually, but also very much collaborating with parents to be able to support them in that as well.
That's wonderful. Yeah, I think that's the big, especially in this society with children too, we're so fast paced. We don't know why we're feeling the way we're feeling a lot of times, even as adults. Mm-hmm. So that key to start really young with children is, it will be life changing for them. So that's wonderful to hear that's your focus. So, oh my gosh, I feel kind of selfish because I feel like I gathered so much insight just in the last 10 minutes talking with you. So thank you so much for, just taking some time with us and explaining, some of these signs that we can be looking for with our children. And I'm really hoping to, and I know it will be very helpful for parents and our audience watching to just kind of feel like they're empowered, during this crazy time that we're kind of going through. So, if any of you here that are watching live in the state of Maryland, you can, and you're interested to hear a little bit more about Dr. Greenberg's work, you can check her out at her website. It's www.drjessicagreenberg.com. And of course, you can find us at leafmentalhealth.com and on our social pages at Leaf Mental Health. But thank you again, Dr. Greenberg, for joining us today.
Of course, my pleasure.
Okay, wonderful. We'll talk soon.
Okay.